everybody. Welcome to this week's episode of Coping Together. My name is Faith, and this is Charlotte, and we both work with the Mental Health Association of Central Florida. And Charlotte, I'm very excited to bring you back today. Our topic we're discussing is suicide prevention and awareness. So Charlotte, go ahead and introduce yourself.
Hi guys, I'm glad to have you all tuning in again. This is Charlotte Melton. I'm the Vice President here with the Mental Health Association. And part of why I'm having this role in the discussion today is two-faceted. I am a QPR facilitator, which stands for Question, Persuade, Refer. And I also host a weekly training for Baker Act rights. And this is another avenue to learn more about the suicide prepared responses in the community. So I feel like I can offer a perspective here and maybe start the conversation for some.
Okay. So Charlotte, I guess what I want to start with for our viewers who maybe aren't so familiar with the term, but what exactly does it mean to be QPR certified?
Thank you so much for asking for clarification. QPR stands for Question, Persuade, Refer. And it's a formulated training that allows the community, family members, individuals to have a conversation with someone about suicide risk. That's a scary conversation. And if you don't feel empowered to have it, you may be worried you're going to say or do the wrong thing. So the more you can inform yourself and support yourself in having this conversation, the better the result's going to be. And it's an exciting opportunity to actually embrace somebody in a really painful time and offer hope. So you can find the QPR trainings available all over the place. There are a lot of formats and a lot of agencies providing them, and they can be in a 1 to 3 hour format. The more information, the better, of course.
And just to add to that, with COVID-19 and the need for things to be virtual right now while we're all social distancing, has QPR in those trainings, and also we'll talk about the guardian advocate trainings, but have those been moved to be online as well?
Yes, thank goodness the QPR Institute understands the need to continue the access to this information. So they have supported a few adjustments for facilitators to maintain the safety of people attending, because it is a pain-triggered topic. So for those of you listening today as well, if this is something that's painful for you, measure your needs and reach out for support afterwards. We're available if this hits a hard spot that you want to talk about. So making sure that the individuals who attend these virtual trainings, that they're safe and that they leave feeling informed and empowered, is what's adjusted from the face-to-face format a little more thoroughly because of the virtual limitations. The Guardian Advocate program has also transferred to a virtual format, so we're able to provide this ongoing training through a Zoom meeting. It is a challenge. I do really relish the opportunity as an agency to be a place where people can come in and face-to-face interact and feel connected when they're stressed and overwhelmed. So there are a few individuals that are challenged with the virtual format. So if that's you out there, you're not alone. And we do hope to open our doors for that when it's safe to do so again.
Okay. I appreciate that, Charlotte, and I'm sure our viewers appreciate it as well. Sorry. And so to kind of add to that, who can become QPR certified? Do you need to be a certain age? What are the qualifications? And we'll also talk about the Guardian Advocate training again in a little bit.
Absolutely. The QPR certification is approachable to anybody. There is a youth version. There are tailored versions that apply to licensed providers, but the baseline QPR is designed for the older teen to adult who is having a conversation with someone they're worried about. And like CPR, wants to be an emergency response guideline for anyone who can be there in the moment of crisis. And truthfully, just like CPR, save a life.
I think you make a really excellent point in that I'm not a counselor, Charlotte's not a counselor, but working in the mental health field, we both are QPR certified. And one of the things I remember learning from my training that really stood out was a lot of people tend to think that you saying something to somebody, saying you're worried about them, asking them if they're thinking about suicide, can put the thought in their head or can make them more likely to do so. And the reality of it is actually it can do the opposite. You're telling someone that you care about them, that you hear them, and that you're worried about them. And I think that for a lot of people, I can't speak for anyone, but it seems like, and from what different data has told us, that it does actually it is beneficial to ask somebody if they're thinking about suicide. And so doing the QPR training really helps you not only learn what to say, but feel comfortable to say so. And so the training in and of itself, I think it's very important for anybody to do it. Charlotte, is it free?
Most formats are free, but it depends on the funding provided to the program who's able to offer those services. So if they aren't receiving as much community support, they sometimes do have to charge attendees, but it's usually an accessible price. And just to have a little of that QPR question conversation now, even if you're not ready to have a training about it, or if the timing isn't right, but you love someone you're worried about, the risk of insulting them or guessing wrong that they're thinking about these thoughts maybe of ending their life, you're not going to know if you're wrong or not unless you ask. And if you ask, the person in need may now feel like they're not alone in their pain and feel connected to somebody who's concerned about them. Or they tell you, no, that's Charlotte, that's not what I'm thinking about at all. I'm just overwhelmed this week and I just needed to vent about it. And now I feel reassured. And that person, like you said, Faith, it just hears that I'm caring about them. So
Mm-hmm.
even though we fight a lot of stigma in the mental health system, asking somebody if they're in deep psychological pain or if they have a need that may need to be supported is not an attempt to insult anybody or to assume a reduced capacity, but that we're all human and some days and some years can be a lot.
I think
And right
2020,
now
we
is
can all
one of
say,
those
has been hard.
examples.
Yeah.
Sorry, say that again.
No, I'm agreeing with you. I think 2020 is one of those examples where it's just kind of been a tough year. I know we're like actually finally halfway through the year and everybody's crossing their fingers and knocking on wood that this is going to be it. But things happen, whether it's in the world or it's your personal life. And I think one question, this kind of leads into my next question, actually, Charlotte, is with COVID-19, a lot of us aren't able to see family or loved ones, and we're seeing them through a virtual avenue. Do you have any advice on if we're worried about someone virtually or how we can help them from afar with social distancing?
That's a great question, Faith. And the message is actually still the same as what I would have said pre-COVID, is no matter how you reach out, reach out. Touch, talk somehow. Right now we're limiting touch a bit. And for those in deep psychological pain, sometimes touch isn't the best interaction. So cautiously and gently and respectfully reaching out to somebody and just saying, hey, it's been a while since we've talked, or more clearly and more directly, hey, these things that you're doing or these things I'm observing are making me concerned and I care about you. How are you? And if you know this person has a history of mood disorders, mental illness, exposure to suicide, they have maybe higher risk factors, you might want to very directly ask, are you thinking about suicide? Are you thinking of ending your own life? The more direct and open I am, the more direct and open I invite you to be. And
And
that's a conversation.
I definitely agree with you. And there's one thing I wanted to add as well with the QPR training. Charlotte mentioned that working in the mental health field, and really all of us in the public, we're fighting the stigma associated with mental health. One of the things I really enjoyed about the QPR training is kind of delving a little bit into the concept of people first language, which is where if someone has a diagnosis, it doesn't define who they are. Someone who has a disability, we're trying to move that from saying they're disabled to they have a disability. It doesn't define who you are. In the same sense with mental health, someone who has schizophrenia, they're not really described anymore as being schizophrenic because that doesn't make up who they are. So at the same time, somebody who has suicidal thoughts, you don't or if they have suicidal thoughts, or you know someone who has died by suicide, there's a lot of thoughts lately and correction in what's the best way to say those things. And QPR really goes into that, where instead of where people used to say commit suicide, now it's died by suicide. And the whole idea of that is being sensitive to the people and understanding of the people who, whether you've been directly or indirectly affected by the loss of someone through suicide. It's just another example of education is powerful, and we can use it to help the people that we love and also help ourselves in future situations. And so I'm sorry to digress a little bit, Charlotte, but I wanted to talk about that a little bit.
It's a perfect opportunity for me to back up your statements with some numbers to really talk about when you consider suicide, some people will think that this is someone else's problem or that this is just out there. Well, it's the 10th leading cause of death nationally. That's pre-COVID. That's totally bizarro life changes, everyday life, pre-pandemic. The 10th leading cause of death in the US nationally was suicide, which outranks murder by 2.5. So individuals, when we're talking about violent crime or gun control, these are serious concerns, but suicide outranks them by 2 plus
Wow.
every year. And I'm horrified to see what we're going to be facing as people's wellness tools and natural supports are harder to access. Like you were talking about with the virtual format, how do I reach out to somebody? I wanted to be uplifting and powerful that just do it. But it is a little harder, and there are some more limitations, and it takes a bit more effort. And when you hurt deeply inside, effort is not always easy to find. The energy to keep trying is hard. So for those of us on the outside who are doing okay, check in with those that aren't and give a bit of our energy. It's based on deep psychological pain. People with mental illnesses, the leading cause of death is suicide. And to break that down into just some logistics, I just said that the leading cause of death for mental illness is choice, a choice to end one's life because the psychological pain is too deep. And that's hard to hear, that's hard to
Yeah.
process. And instead of leaving in that heavy spot, I want to bring us out of it with the idea that you don't have to have a perfect solution for someone in pain. What we have to offer is hope that there is a solution, perfect or not, that there is a tomorrow and it might have something better in it, and that trying is worth it, and that someone believes in you. So suicide prevention is about looking at ourselves, looking around us, staying connected, and actively bringing light into our lives and others.
I do really appreciate you touching on that. And that kind of leads me into a question. I know we're running, getting to our time, and I still want to talk briefly about the Florida Baker Act and Guardian Advocate Program. But I would like to ask you, for anybody who maybe is currently struggling with thoughts of suicide, whether it's thoughts, plan, intent, whatever it may be, um, can you tell me and tell our viewers what resources are out there for those individuals, whether they've attempted suicide in the past, or they've struggled with thoughts of it, just kind of finding out what's out there, especially now in the time of COVID?
There are thankfully ever evolving resources, which is what's neat about the technology format. You can call the Suicide Prevention Hotline. You can text the Suicide Prevention Hotline. You can text the number 741-741 and use the word home as the message. Or you can call the National Suicide Hotline. We'll put that into the chat details so you guys can access that resource. And 211 is a resource we depend on as an agency to help connect to certified counselors. They're not at the master's level clinician, but they receive vigorous training to feel prepared and empowered to connect to you in your moment of need, 24 hours a day, 7 days a week. You pick up the phone, dial 211, and there's someone there to listen because you matter, and there is tomorrow, and it might be okay.
I absolutely agree with you. And to add a little bit to that, our organization, as well as several other organizations in the area, offer different support groups for those who are struggling with thoughts of suicide. I know ours in particular has moved to a virtual format. If you are wanting to talk with people maybe who you feel can relate to a little bit of how you're feeling, that might be a time to look into a support group. If you're looking to talk to a counselor, please reach out to us. One of the things that we do with our connections program is we look for counselors who have that experience and that willingness, and really that experience and expertise to work with individuals who are struggling with thoughts of suicide. So we care deeply about anybody who's struggling, anybody who's having a hard time, anyone whose loved one is having a hard time. So I just wanted to throw that in there real quick. Sorry, Charlotte.
Thank you so much, because I was focused immediately on the moment of someone in pain with those thoughts and in need of connection. But if there's in your mind, you're feeling pain, but you can see tomorrow and maybe the day after, we do have a suicide support group led by a clinician. And there are a lot of resources out there where we can connect people to you who are willing to have this real, candid conversation and help find the hope that keeps you moving forward.
Thank you for elaborating on that. I appreciate it. And so my last question, or a few questions really, not everybody is familiar with the Florida Baker Act and the concept of a guardian advocate or somebody being in that state. Can you elaborate on that for our viewers?
In the state of Florida, there's a law designed to protect an individual and determine patient rights and the flow of the system with balance of civil liberties, where an individual can check themselves into the hospital just like you would go to the ER, but for your mind. So when your thoughts, your behaviors, or emotions are putting your life or someone else's in danger, there is a safe 24 hours clinically supported hospital environment that can triage your needs. It's not a service you take lightly. It's definitely there for emergencies. And there are a lot of outpatient resources that someone can access earlier with less restrictive intensities. But in the moment, if there's such a risk of danger, there is intensive help. And there are respite programs that are developing slowly across the state that allow individuals to access this kind of separate environment without it being completely clinical. So idea is that there may be stages towards it. But if you call 911 and you or your loved one are in need of help, use the keywords of mental health or Baker Act crisis and ask for a CIT officer. That crisis intervention training will help bring an officer who is certified in understanding mental health and de-escalation to the scene to help you guys determine if the Baker Act is the appropriate safe next step for your family, or if connecting to outpatient resources is more reasonable.
And you mentioned that you do this training for individuals regarding what's called being a guardian advocate. Can you kind of elaborate on when a guardian advocate is necessary?
I'd love for anyone to take the training. It does certify someone to be a surrogate decision maker if their loved one is Baker acted and unable to make their own decisions. But in the instance where someone might be facing this crisis service, I love the opportunity to educate a peer on what they'd be experiencing in the system. So it can demystify the Baker Act a bit to have this 4-hour discussion, and you would leave certified. We also have internships available through it for those that are looking to help people who don't have loved ones available to help.
I really appreciate everything that you've talked with us today about Charlotte, because I think suicide is something that isn't talked about as much as it should be, in my personal opinion. And I think that the best way, like you said, is to start a conversation about it. So with that being said, if you have any questions, if you are wanting help, if you think that you might know someone who's struggling, or you're struggling yourself, please reach out to us. Please reach out to the Suicide Hotline. Please reach out to 211. One thing that I am proud of is there are a number of resources, especially during COVID, that are trying and wanting to be there for everybody. And we're all going to get through this together. COVID is at some point going to end, but that doesn't mean that life's not still hard at times. And so that's really where I think mental health resources are very important. So with that being said, thank you as always, everyone, for taking the time to watch our video. Charlotte, thank you for being here. If you guys ever have any ideas of topics, please reach out to us. Let us know in the comments below. We would love to work that into our show and our schedule. And as always, I look forward to seeing you next time. So thank you very much and have a great day.